Imagine waking up with blurry vision and a pounding headache behind your eye. You might think you need glasses, or maybe it is just a migraine. But look closer. Deep beneath the surface, your body is telling a different story. This is not just an eye problem. The real culprit is hiding inches away, down here in the jaw. This is a journey into one of the most surprising and dangerous connections in the human body, seeing how a single infected tooth can threaten your sight, and the incredible dual surgery required to save it. Let us peel back the layers to understand the danger. See that upper molar? On the outside, it might look okay, or maybe just a little sensitive to cold. But inside, in the deep roots, the nerve has died. A dark toxic infection has taken hold. It is not staying put. It is eating through the jawbone, traveling upward like a silent storm, pushing through the sinus floor and pressing directly against the delicate orbit of the eye. That red pulse you see is inflammation spreading. It is squeezing the optic nerve. If we do not act now, that pressure could cause permanent blindness. The rescue mission starts not at the eye, but at the source. We must stop the infection where it began. We begin with the tooth. The patient is prepped, and the area is isolated with a protective sheet to keep it sterile. We need to shut down the poison factory. The surgeon uses a high-precision drill. Watch as it gently removes the hard enamel. We are entering the pulp chamber, the hollow heart of the tooth. It is filled with necrotic, dead tissue. This is where the bacteria are breeding and multiplying. Now comes the deep cleaning. We use these incredibly fine, flexible instruments called files. They spiral down into the microscopic canals of the roots. Think of them as tiny, high-tech bottle brushes. They rotate and scrub the walls, pulling out the infection and debris. We flush the area with powerful cleaning fluids to dissolve any remaining bacteria. It has to be absolutely spotless. Once it is clean, we cannot leave it empty. We inject a warm, rubbery material that flows like liquid. It fills every tiny crack and crevice, sealing the root tight. This door is now closed. No more bacteria can escape from here into the body, but our work is not done. The source is blocked, but the pressure it caused upstairs is still waiting. We have to move to phase 2, treating the eye. Even though the tooth is fixed, a dangerous pocket of fluid, an abscess, is still trapped behind the eyeball, crushing the nerves. We have to drain it to save the vision. The surgeon moves with extreme delicacy now. We do not want to leave a scar on the face, so we make a tiny, invisible incision right in the natural crease of the eyelid. We are entering the orbit now. This is a crowded space, filled with muscles that move the eye and nerves that carry vision. We gently navigate through the orbital fat, pushing tissues aside without cutting them. We are looking for that hidden capsule of fluid resting on the floor of the eye socket. There it is. Watch this moment closely. The surgeon uses a specialized suction tip to puncture the abscess. As the thick fluid is drawn out, look at the anatomy respond. It is almost like the eye takes a deep breath. The muscles relax. The optic nerve, which was being strangled by pressure, is finally free to function again. The angry red color of inflammation begins to fade to a healthy pink. We wash the area thoroughly with sterile saline, ensuring no trace of infection remains behind the eye. The closure is an art form in itself. We use a suture thread so fine it is barely visible to the naked eye. The skin is brought back together perfectly, ensuring that after healing, no one will ever know surgery happened here. Now the body's natural magic takes over. Deep at the cellular level, the war is over. Fresh blood brings oxygen and nutrients to the site. New cells knit the tissue back together. The bone around the tooth begins to harden, and the space behind the eye returns to its normal, healthy state. Finally, we see the result. Light enters the eye, travels through the clear lens, and hits the retina perfectly. The signal shoots down the healthy optic nerve, straight to the brain without interruption. The blur is gone. The pain is a memory. The patient smiles, revealing a healthy, restored tooth. From a terrifying risk of blindness to a full recovery, this is the miracle of precision medicine. The balance is restored.